Okay, we're recording. You want to go first, Car?
You go ahead.
Okay, sounds good. Um, so my name is Erin Gattuso. I am a naturopathic doctor and a cranial psychotherapist, and I am very excited about this webinar because about a third of my population are babies. So I ironically have this unique niche of working in the first basically 3 months of a child's life. And I do a lot of different things, and I work with basically trying to evaluate both the mom and the baby to see, why are things not syncing up as well as they should, and how can we make this transition a little bit easier. And not to be dramatic or anything, but that's kind of who I am. I kind of feel like it's one of my life purposes to just basically help usher new babies and new moms into this world, because it can be a bit jarring to go from the womb to, real like outside life. And so helping anything you can do to help that transition not only helps the trajectory of that baby's life, but also, the trajectory of that family unit. And it's a really powerful, sacred time. So I love this topic, and I love that I get to share with you different things that I've picked up and learned along the way. And this is my dear good friend, Carly Gossard. If you want to introduce yourself.
Yes. Hi, everyone. I'm Carly. I'm a doctor of physical therapy. I specialize in pelvic floor physical therapy and postpartum rehabilitation. My business is Empowered Pelvic Health, and I provide concierge physical therapy services to women and moms in Bergen County. I've been inspired by patients, by friends, by family. I think it's our job to really take care of our moms and to raise the standards of postpartum care in this country. I think we have a lot of work to do. And my whole goal is to raise awareness and to educate people that certain things are common and not normal, and that there's a lot of help and skilled therapists out there that can treat these things. And an aside, Erin and I are old college friends. She was over in San Diego for years and years. And it's just so cool to have been able to work with you for this whole webinar for these 3 sessions. I've learned so much from her. She is just a wealth of knowledge. I joke that she's the baby guru, because she really is. And
which is ironic because actually neither of us have children.
Correct.
That actually is in some ways to benefit, because we're able to look at things very objectively. Of course, there's things we don't know because we haven't had that experience ourselves, right. But we do work with that population every day.
But I really think it's so special how our love of women's health in 2 different arenas. You're a naturopathic doctor. My career took me into pelvic floor PT by one way or another, and it's always kind of like brought us together, and it's been awesome doing this.
We have a good time.
Okay, sure. We do. So,
and I should actually mention, I work at Turnpaugh Health and Wellness in Manheim, Pennsylvania. Should mention that too.
Yeah, with a great group. So what we're going through today is discussing the postpartum period, common symptoms, diagnoses, learning about pelvic floor PT. I think a lot of people don't know that it exists and what we do if and when it's indicated, especially in that postpartum population. Talking about some easy modifications for mom during that postpartum period to avoid some of these symptoms and painful things that may arise. Erin's going in depth into lactation, latching, colic, reflux, tongue tie, really any feeding difficulties, and also a great bit on craniosacral therapy for babies. And I think our goal too, it's amazing the work that you do, because you evaluate mom and you evaluate baby, and it is jarring for baby to come into this world. And I think we don't really think about that, but then also the transition for mom and adapting to those new roles and adapting to the amazing, changes that have happened in the body. So transitions for both baby and mom.
Yeah, absolutely. Okay, when we talked about kind of the essence of this, why is this time frame so important? This is often referred to as the 4th trimester, the first 12 weeks after the baby is born. And this can be a really beautiful time, but it can also be really bumpy. And there's a lot of things that can be really challenging. And there's not necessarily great resources. So we're just going to touch on some of those things that, you know, you might come up during this time, things that can actually disrupt the maternal-infant bond, which is so important, because ultimately what we're trying to do here is, you know, build a healthy, resilient nervous system in these little babies. And we know that basically the nervous system, the biggest, I guess, growth period is in the first 6 months. And so specifically, whenever it comes to having like a well-regulated nervous system, and when I say well-regulated, that means like, can they control their emotional health? Can they control, you know, even like more autonomic things like breathing and heart rate? Like, are those going to be under proper control? And that all has to do with the vagus nerve. And so we're going to talk a little bit about that and how do we make sure that that stays nice and healthy. I have to mention skin to skin during this time. It's of the utmost importance in creating that bond because it produces oxytocin, which is, we'll talk a little bit more about that, but that's kind of like the cuddle hormone. And actually, if you want to mention the Rubin postpartum stages, early, that's yours.
Yeah, so this research in 2009 really talks about those first 6 months and how, I mean, the first couple of days is just taking in what had just happened, right? So like I just said, it can be jarring for moms. So the first stage of being taking in the following weeks of, you know, learning your baby and learning how to care for baby and everything that goes with it. And then the letting go and the truly adapting into your new role is very individual. And, you know, for some people, it might feel like this process is pretty quick, but they've showed that this adaptation time really can be up to 6 months. So taking that into consideration and giving yourself grace and knowing that it can take up to that long for you to feel like, okay, I got this.
Right.
Yeah.
And longer, truthfully.
Yeah.
Okay, so the very basic thing to start with is you just did this major thing. You literally created a human and then you birthed it out. And how can we help rebuild mom? And this is of the utmost importance because often moms are not eating as well as they should be. But the thing is, even if they are eating, some doesn't necessarily mean that they're absorbing all the nutrients that they are taking in, because truthfully, the body is still under stress. And so you want to give your body the most easily broken down food that you can. And so we're thinking hot foods, cooked foods, foods that are rich. I have a picture. This is khichdi. This is a traditional Indian dish with lots of warming spices. Think warm, warm, warm. In fact, in some cultures, they actually take big stones and warm them and put them on the mom's belly. And that warmth helps her body heal. So, hey, what you doing on this? Wait, can you go back?
Oh my God. Sorry. Technical difficulties, don't mind me.
Okay.
I think someone's waiting in the waiting room there. Sorry to interrupt.
I got it. Thank you, though. Anyway, so we want to think foods high in calcium, iron, and choline. So choline is kind of a nutrient that doesn't get as much attention. It's really high in meat and eggs, especially egg yolks. But this nutrient is actually the one nutrient that they've been able to connect to baby IQ. So getting enough of it in your diet actually has been proving to raise the baby's IQ. So I always like to say that because that's an easy thing to try to incorporate. One thing that is low in almost every mom that I work with, because I actually do blood work on a lot of the moms, and I test their omega-3s, and so many of them are very low in DHA, and that's because whenever you're creating a human, it literally will steal your omegas from your central nervous system. So DHA builds the central nervous system. So of course, that's going to take priority whenever you're building your baby's brain. But then even as you are breastfeeding, it's still stealing that from your nervous system. So as a result, moms feel foggy headed or forgetful, or their mood can be really compromised. And so simple things as taking DHA when you're breastfeeding can just help alleviate a lot of those symptoms dramatically. You can even give DHA to the baby directly. And I'll talk about situations where that might be a good thing to do. An immune function. So the last thing you need is to be breastfeeding and healing from giving birth, and then you get sick on top of it. And then not to mention mastitis, which also happens so frequently. So it's not uncommon that your immune system will actually kind of crash after you have a baby, because it's largely because nutritional stores are so depleted. So I just tested, I just was looking today at the blood work of a mom that had repeat mastitis, and her vitamin D was dangerously low, and she's taking a prenatal right now because a lot of people continue taking the prenatals. And so even on the prenatal, it was not even close to where she needed to be. So just getting that tested by your most primary docs are open to testing vitamin D, and like that little test can make a big difference. And rest. So even though a lot, moms are always tired, rest can still be a big issue for them. And whether it's because as soon as they lay down to sleep, they start thinking of all the horrible things that could potentially happen to their child, which, there's so many things to worry about whenever you're a mom, whatever it might be. But you can't necessarily use sleeping meds right now to knock you out either. So just taking things like magnesium, phosphatidylserine, phosphatidylcholine, these are all things that are actually wonderful for the baby and you at just calming the nervous system. And so everybody's a little bit healthier and happier whenever everyone's sleeping. So that's just basic.
And this is totally anecdotal and just to hop in, but a patient of mine told me about tart cherry juice also helping to naturally release magnesium and help you sleep. So she would make like little mocktails with like seltzer and the tart cherry juice before bed, and I tried it and it's beautiful and tasty.
Hey,
yeah.
Can't go wrong with it. Tart cherry juice is really, really good for gout. I don't know the connection to sleep, but it wouldn't surprise me. Anyway, so postpartum mood disorders, we don't have enough time to give this the depth that it really requires. What I will say is that postpartum depression gets all of the hype, whereas postpartum anxiety is really common. And especially if you had anxiety previously or you had OCD previously, it can really get heightened and moms can really be miserable, but they don't necessarily recognize that there might be a problem because they don't identify with the depression picture. And so there's different things you can do to support all of these things. Really, you should go see somebody if it's a major issue, but even just simple things like motherwort tea, if you have anxiety, can be so helpful. Motherwort tea gets its name. It really means healing the mother. It's a very traditional herb that's used after pregnancy, and it's safe in breastfeeding, and it's very soothing to the nervous system and really helps with anxiety. Depression comes back to these fish oils, phosphatidylserine, and really just building yourself back up. And then, of course, there's hormones, which obviously we also could be a whole lecture in and of itself, but it's kind of like PMS on steroids, because, we all have had PMS where your hormones drop and your mood drops. And then now you go from pregnancy, which is so many more hormones than just regular cycle. And then it goes back to relatively normal. And that drop can feel so severe and really mess with your serotonin levels and everything like that. What I will say is that if it's significant, it's worthwhile to get also these checked out. So I just had a woman who had postpartum psychosis, actually. And she had actually been institutionalized and all these things. It was a big case. It was a challenging case. And I ran her pituitary hormones, like oxytocin, prolactin, and some other markers. And all of her pituitary hormones were low. And she actually had a pituitary issue, that was causing her psychosis. So that's an extreme example, but less extreme versions of that example happen very frequently. So definitely worth getting that checked out if it's really inhibiting your life.
Mm-hmm.
Oh,
Yeah.
and I should mention thyroid. Like if you already had thyroid issues, like a fourth of women have thyroid issues after pregnancy. So this is very common, and depending on if it's high or low, can really contribute to depression or anxiety. So even just getting that checked out is very helpful for a lot of women.
Right. And we had even talked about during that pregnancy webinar how your thyroid during pregnancy is really in overdrive and is working so hard that it's common to have thyroid dysfunction during and postpartum. So that's something to address, prior, during pregnancy, and realize that that can be a big part of mood and fatigue and energy.
You're losing baby weight and all that stuff.
Yeah. So to piggyback off of Erin with postpartum depression, research study in 2011 showed that out of almost 2,000 moms, about 10% had postpartum depression. Honestly, I would argue that maybe not all were reported. They found that the strongest 5 predictors of postpartum depression was the mom being younger than 25, the mom being readmitted to the hospital, difficulty or inability to initiate breastfeeding, how they reported their own health was, maybe mental, physical, their self-reported health measure. And this is a big one. I can't wait to touch on this later. Urinary incontinence is so highly linked to postpartum depression. And I have to give it up for France. I think we should all move there. Their postpartum care is so incredible. Every woman, regardless of if she had vaginal delivery or cesarean delivery, after that 6-week checkup, is mandated to get 12 sessions of pelvic floor physical therapy and biofeedback. And their rate of postpartum depression and urinary incontinence is a fraction of ours. And I think they go so hand in hand. And I mean, it makes complete sense. You are sleep deprived. Like Erin was saying, your hormones are fluctuating, to accommodate this new transitional phase. You are caring for a tiny little human. And then on top of it, if we're buying pads, if we're leaking, if that leaking is keeping us from returning to meaningful exercise and the things that you love, that could be a big source of postpartum depression and something that's super treatable.
Just a loss of self. Ultimately.
Yeah, and a loss of control, feeling to not have, these are women in their 20s, 30s, 40s who are losing bowel and or bladder and sometimes bowel control. And we know that, it's not supposed to happen really at any stage of life, believe it or not, but especially in these prime years to feel like you lost that control, it totally makes sense to me.
Right.
That they're so linked.
Okay, so I'm going to talk about cranial psychotherapy for a couple minutes because this is my baby and one of my favorite things. This is my baby. So one of the founders of cranial psychotherapy, his name was John Upledger, and he said if every infant had one cranial psychotherapy treatment, we would have a much more peaceful world, which is a big statement. But after you've seen a baby that had a cranial psycho treatment, you understand why he says that. Because I often get these angry, upset, fussy babies who the parents, they're 2 months and their parents are frazzled and they're like, they haven't stopped crying since they, came out. And as soon as we do a cranial sacral treatment on them, the baby stops crying and goes into this super relaxed mode, and the parents' eyes kind of bug out and say, what did you do? And they're like, are you magic? I'm like, it's not magic. This is a mechanism. This is something that we can do to help restore that self-soothing mechanism in a baby. So I'm going to explain to you a little bit how that works. So CST is a very light touch modality. It's literally the weight of if you put a nickel on your skin, that's how much pressure we're putting on the skin. Because we're not trying to work with the muscle, we're trying to work with the fascial tissue. And with the fascial tissue, we try to basically help move the fascia to help the cerebral spinal fluid movement in the central nervous system. So those are a lot of big words. But if you want to go to the next slide.
Yeah.
Can you play this video? Yep. So here's a really cool video that it was actually very recently done. And so the red part that's happening, it's basically there's the brain is becoming more active and glucose is going to those areas. Yeah, if you want to keep playing that. And then if you notice this little blue area right here that pops up, basically right after the brain has a excitatory brain wave, this other wave comes in. So that blue is the cerebral spinal fluid. So they are just now kind of catching up to what we've known for a long time in the science world. This study was done in 2019, and the quote next to it says, the end of it says, but before now, we didn't realize that there were actually waves in the CSF. There are actual waves in the CSF. And it's actually ironic because the cerebral spinal fluid is one molecule away from seawater. And it's like a salinated like water that's in our central nervous system. And what happens whenever you see this little blue dot is there's ventricles are basically like little balloons inside the brain, and they fill up with water or the cerebral spinal fluid, and then they drain. So you see this rhythm, and they used to just kind of think that it was to protect the brain, and now it's really coming out and it's becoming a lot more understood that the cerebral spinal fluid actually detoxes the brain. So this they know happens at nighttime. They know happens when you're sleeping, and if you wake up the next day, like if you wake up in the morning and you don't feel refreshed, if you still feel tired, there's a chance that your cerebral spinal fluid was not cleaning, quite literally cleaning your brain as well as it could have. And so, this research is all coming out and how its role in Alzheimer's, its role in degenerative diseases, but those are in adults. But babies have this system, and this system is often compromised in babies, whether because they had a traumatic they had traumatic birth, vaginally, or even C-section, it can happen. And so if a suture is jammed, or let's say they were just like in the womb in a weird position and their brain, like their skull,
like the skull.
Right. And you're able to see it, like this baby here on the left, you can see there's a ridge in her sutures there. So if that is compromised, then that cerebral spinal fluid is not able to expand as nicely as it should. And so in a baby that's fussy all the time, not always, but often, what's going on is that cerebral spinal fluid system is shut down, and they therefore basically don't have their self-soothing mechanism. And so whenever you are able to restore it, you're literally able to restore peace in their nervous system. Like, how powerful and amazing is that? Mm-hmm. And not to mention, just as far as like neural development, like making sure that your brain has its proper cleaning mechanism in it is really important. Probably in ways that we can't even begin to fathom and understand at this point. But I think it is becoming more important because we are exposed to a lot more than we used to be. So actually, if on these pictures, here I'm working in the mouth. So this is a baby that had trouble with latching. Here I'm working on this little boy's hyoid bone, which connects to the bottom of the tongue. This was for speech issues more so. And this little guy, I was working on his sacrum. And so this was more for like constipation. And this was one of those colicky babies that just calmed down and was really, really peaceful. So,
sorry, go ahead.
No, finish what you were saying.
I think of traumatic births. I think of forceps deliveries, vacuum, like really emergency situations where they have to get baby out. And I can think of a specific family where it was an emergency vacuum, and that baby was like very, I wouldn't say like such a great temperament, and I wouldn't say fussy, angry, but like nervous, like shaky. And I was like, it makes complete sense. Like, that is traumatic, of course.
It is. Like, your entrance into this world really can dictate how you view and interact with the world. Absolutely. Okay, so difficulty feeding. I only have one slide on this, and literally I could talk on this for days.
This could be a whole
whenever we talk about that mother-daughter, that mother-infant bond, and I don't mean to exclude the fathers, but unfortunately, just for time's sake, we have to exclude the fathers, even though they're very important. When there's a difficult time feeding, this is so stressful on the parents, and they go into this very primal part of their brain where like logic doesn't quite fully, allow them to think clearly sometimes, because they're just in this, I need to feed my baby because I understand this is important for it to survive. It's a really big deal. I can't stress that enough. So whenever we think about feeding, the first thing we want to really look at is the roof of the mouth. If the roof of the mouth is high and arched, that means that basically the tongue has not been contacting the roof of the mouth as well as it should have. And the baby sucks, I think, I want to say from 12 weeks in utero on. So it swallows the amniotic fluid. And so you're not just dealing with, a muscular pattern that's been for the 4 days. This muscular pattern has developed over a long period of time. So even if you do different procedures, which I'll talk about tongue tie a little bit more, but let's say you release the tongue tie, sometimes that's not quite enough. Often it is, and that we're very thankful when that is the case. But sometimes it's not enough because you have to really work on the musculature and retraining the mouth and retraining the tongue. So whenever it comes to the suck reflex, because often, also there are times whenever the baby's palate is nice and low, but they still are having trouble breastfeeding, then we think more of a suck reflex. And so this really has to do with how mature the vagus nerve is at birth. So we know that premature babies have a much harder time doing the nice suck, swallow, breathe. And if the suck, swallow, breathe pattern gets out of coordination, what happens is you actually have like decreased oxygen to the brain, and the babies will get tired and fall asleep. And so they're not able to feed for very long. And I see this very commonly, that babies will feed for like 2 or 3 minutes, and then they just kind of fall asleep, and then they wake up crying because they're still hungry. And so when that's the case, I mean, it can be structural, but sometimes it really, like, that is a pure, let's work with them doing cranial psychotherapy. Let's work on making sure their cranial nerves innervate their tongue properly so that they get the proper information basically being sent to those muscles. So that's really important. And the suck reflex, I'm going to digress for 1 minute, is so important, because whenever we're thinking about the development of the nervous system, before you walk, before you crawl, what do? You eat. That is the biggest stimulus that you can give your body. And so this is truly the foundation of building a mature and organized, I should say, nervous system. And then if you really want to get into, in many cultures, they understand the connection between the tongue and the top of the mouth is really important for like Chinese meridian chi flow and that kind of stuff too. So tongue ties, I joke, I'm like, somehow I became a tongue tie expert. I don't know how that happened, but I think it's because they so easily get misdiagnosed. And so it's not uncommon for moms to go to like 3 or 4 lactation consultants, and each of them tell them that it's fine whenever it's not fine. And I think the reason why I might be able to catch it and lactation consultants sometimes don't catch it is because I use my finger and palpation skills to diagnose it, versus I think they visually try to see it. And so sometimes you can't tell when you visually look, but whenever you feel, you can tell that the tongue is really restricted and not able to move as well as it could. So when this happens, best, I like sending babies to pediatric dentists. They're my favorite people to treat. So this because pediatric dentists usually use laser, and I think they can just get a little bit more detailed and a bit closer. So it tends to turn out better, and they tend to have better results And a lot of pediatricians will do it, but they don't get as deep as they should. And so then I've seen it multiple times where babies have to get more than one revision, and that's a nightmare for the parents. So try to go to a pediatric dentist, I would say, if you ever come across that. Okay, so milk quantity and quality. So boobs are amazing. Carly and I were joking. We're like, please have a slide to say like boobs.
We had a slide that said boobs are so smart because they really are.
Because they basically sample the saliva from the newborn and make a perfect little concoction for that baby. They construct what nutritional needs it needs in that time of development, what immunological needs, like as far as antibodies it might need. And like if the baby is sick, it will very much change its formula, its makeup, which is just so amazing.
I was shocked. You were telling me about twins.
Yeah.
So it'll do the individual needs of the twins regardless of what side you're feeding on. And I was like, I had no idea. So
yeah, I think I couldn't find that paper, but I know I've read it before, that I want to say it's like if you have one twin on one boob and one twin on the other, like it will create different formulas for each twin. If somebody has that knowledge, want to type that in and let me know. But so the other thing that's really interesting is that the milk at the beginning of a feed is different than the milk at the end of a feed. And so the initial milk is really high in glucose and carbohydrates, and the end feed is really high in fat. So the reason why this is important is, some babies are not able to stay on the boob and actually suck it till the end of the feed, because some people, the end of the feed is in 4 minutes and some of it's in 40 minutes. And so there's a big difference. But what you see is that if a baby only gets what we call the fore milk, the initial high glucose milk, then that baby will be hungrier much faster. And you get more cluster feeding. You get that they need to eat pretty much continually. And what also is seen is if they don't ever seem to be able to get to that end milk, then they don't get as much fat in their system. And so you actually will see that they have like drier skin because they don't have enough essential fatty acids. And then my mind goes, well, what about all the fat derived vitamins like vitamin D and vitamin A? My guess would be that they're not getting enough of that either. So depending on the situation, whenever I said, usually I would always give the mom DHA. But I recently just had a mom who she can't get to her hind milk because there's a lot of different reasons why she can't. And so that might be a situation where like, okay, well, let's just give the DHA directly to the baby then, since we're not sure if they're getting it. And we can tell that their nervous system needs a little bit more fat and a little bit more support. Okay, what else should I say about all of that? So low milk. There's a lot of herbs that have been used for centuries, and it's really funny.
Supply, you're saying.
What'd you say?
To help increase supply.
Yes, thank you for helping me.
Yeah.
Like that. So I'm at my office and I realized that I have this women's nursing support blend by Yogi, and I was like, oh, I wonder what's in here. And it is the typical. So fenugreek is kind of like the most famous one. So this is it increases oxytocin, and it can increase your milk supply. But what also is in here is chamomile. So chamomile is not going to actually increase your milk supply. Why that's helpful is it's just very common to the nervous system, and it's a bitter. So if there's any sort of reflux, it can help with that. It's one of the main things in gripe water. And yeah, lavender is in here too, and so that's also good for the nervous system. And then oversupply, if you have an oversupply, the best thing to do is just limit the baby to one breast so that they're kind of forced to get that hind milk. And then also that will suppress the milk supply and decrease it over time. Okay, next one.
Yeah, it's supply and demand, right?
Right, supply and demand. So This is really interesting. I found this paper, which, side note, there's like no research on breastfeeding moms and babies. It's shocking. Like all the research I found was from the 80s, and I was on PubMed, all the right things. They don't do that research hardly at all, it seems like. But what I could find was, so if the mom doesn't have a sufficient amount of calcium, iron, carbohydrates, proteins, and fat in their diet, it doesn't matter, because the body will steal those nutrients from the mom and make sure the baby has everything it needs in the breast milk to thrive as much as possible. So, I mean, obviously you don't want to deplete the mom, but at least from the baby perspective, this is a good thing. That is not true for things like vitamin D, vitamin A, and thiamine, and I would wonder about the other B vitamins that were not listed in that study. And so, if the mom is low in vitamin D, the baby is going to be very low in vitamin D. So I already gave the example of the mom that was low in vitamin D. And vitamin D is really important for immune regulation to help prevent against asthma and allergies, and also mood. So that's significant. So when we talk about protein in the breast milk, mainly the way that that's introduced is through amino acids. Mostly it's broken down already to amino acids, and glutamine makes up over 50% of the amino acids in breast milk. So what's interesting is that glutamine is probably the most used supplement by functional medicine doctors or naturopathic doctors or whatever, because glutamine feeds the digestive lining and helps build a strong gut barrier. So for treating leaky gut is kind of the common way of saying it. We give somebody glutamine because that helps basically build their GI tract to be stronger, and which is what we want for a little baby, because every single baby is born with leaky gut, hyperpermeability, which is why you don't feed babies steak at 2 weeks old. They can't digest it. It would really mess them up. So glutamine is really impactful for developing that digestive system, which now we know it means a lot. So I am very quick to give a mom glutamine if I see them, especially if I suspect the baby has some sort of GI issues. Colostrum, right? So that's at the beginning of breastfeeding and then decreases over time. I mean, we use colostrum all the time to basically increase the immune system of the.
As a supplement, you can give it?
Yeah.
Wow. Okay.
But we get it from cows, not humans. So it's a little different, but same concept. And the microbiome. So the breast milk is not sterile. There was like this belief that breast milk was sterile, but we actually pass bacteria from the microbiome through the breast milk. So, making sure mom's on a good probiotic, and honestly giving the baby a probiotic is often a good idea too. Yeah, the rest are just, you can skip through this one.
Okay.
And I don't want to leave the formula moms out because fed is best. And I know I talk a lot about breastfeeding, and breastfeeding is amazing. But what's interesting is that formulas have increased their quality so much in the past 5 years. I'm shocked, because I remember I did research on this probably 5 years ago. It's been a while, and I was kind of horrified by what was available on the market. And this time, whenever I did it, they're really catching on to the holistic health concepts, and the quality has just improved so much. So,
yeah, I was shocked to hear you told me one brand, I won't say, and I honestly don't remember. The first ingredient wasn't like high fructose corn syrup?
Yes. So and I thank you for mentioning that, because I will. So a lot of formulas, the first ingredient is high fructose corn syrup or maltodextrin, corn maltodextrin, which is basically corn syrup. And the reason why is because, so those are actually in the sensitive formulas. And so babies that have a lot of colic or gas or GI discomfort, it's sometimes because they can't break down the lactose in the milk.
That's the easiest one to digest.
And it's, yes. So corn syrup is the easiest like sugar to digest. It's still not optimal though, I would say. So there are times when I think you do have to use it, but trying to use other ones I think is preferred. So like Enfamil, like there's these A2 formulas now. So when it comes to dairy, if you're in the dairy world at all, which I live in Lancaster County, so I am inundated in dairy world here. And so I work with a lot of Amish people. And it's funny because a lot of Amish people who have even dairy farms, they will have one specific A2 cow because they are very up on the holistic medicine concept. And the difference is that there's this inflammatory protein in milk that causes problems for most people called casein. But in this certain type of cow, it's a different type of casein that is not inflammatory. So they themselves drink this A2 milk. And so now these formula companies are catching on and they're getting grass-fed A2 milk for the formulas, which I think is amazing. And that would mean that it's a lot less inflammatory as a dairy product. So let's say you try a normal dairy-based formula, baby reacts to it. Well, maybe try the A2 formula because you might actually have a different experience with it, which I think is really cool. Another options are goat milk-based formulas. So this is controversial. Some people say you shouldn't give infants goat milk. You know, I've seen that be a life-changing thing for some families who have trouble with weight gain and reactions and that kind of thing. And they react really well to the goat milk. So I think it's a really nice other option. I would much prefer somebody do goat milk than soy-based, but soy-based is there too. And, you know, well, that's an option. Also, you can make homemade formula. You have to be very, very careful, and I wouldn't necessarily recommend it for infants, but you know, maybe like 2 months and on, I think that it's fine. And so there's a link here to Weston A. Price and with that information. Okay, so infant reflux. So this is a really common reason why people end up coming in, and it can be because they have trouble with feeding, and so they're swallowing too much air, basically. And it could be that simple, or it could be they're having food allergies. You know, there's a lot of different reasons why this might be happening. But when it comes to treating it, there's a couple different things you can do. Well, first of all, one thing, like a keynote for infant reflux is if the baby is arching back. And so the baby doesn't actually have to be spitting up. But if the baby is arching back every time it eats and is highly uncomfortable, that could have basically called silent reflux. On the flip side of that, you can have all babies spit up. It's only a problem if it causes severe discomfort and crying and consistently for them. If it's like once in a while, it's really not an issue. So body work is amazing for this. This comes down to cranial sacral therapy and often just creating a little bit more space right here where the spine meets the skull. Just creating a little bit more space there can sometimes allow the vagus nerve to work a little bit better and can be like that for some children. And then for some children, it's really about, you know, having the mom maybe change her diet.
The vagus nerve is like so powerful and so complex. It's like the longest, most complex of the cranial nerves. And a lot of times if patients are coming in for like adult patients with GI distress, sometimes we have to like zoom out and address that, work into the neck, work into that suboccipital region underneath the skull, like you were talking about. Yeah. And it really does make a world of difference. If those nerves don't have anywhere to move and glide and they get kind of stuck and they're not communicating with the body as they should, makes all the difference.
And it's fun, like even in adults, you put your hand here and you work this region. and then all of a sudden you hear the person's stomach gurgle.
Yeah.
Like, because the vagus nerve like wakes things up, and then people always apologize. They're like, "Oh, I don't know why my stomach's doing that." I'm like, "That's normal. It's cool."
Right.
And same with babies. They'll often have like a bowel movement on the table. So Lactobacilli reuteri is one probiotic that's been proven to be very helpful against reflux. And then also herbs, gripe water, which is usually chamomile and fennel, and a little bit of like not carbon dioxide, bicarbonate. That can be very, very helpful. And one last thing, which I can't remember what I was going to say, which is very helpful. It's escaped me, but what I will say is the food allergies can be a major issue. One thing that can drive a parent crazy, though, is trying to figure out which food is the issue. And so I will sometimes do like a food allergy test on the mom and see what she comes back to. So I recently just had a mom who the baby vomited every time she ate, even, now she's in solid food now, and she still vomited every single time she ate. And the mom was like, I cannot take out gluten from my diet. I already took out dairy. If I take out gluten, I will just waste away and get too thin. And so we did a food allergy test, and it turned out that she was reacting to oats. And so all she needed to do is take out oats, and everything turned around, and the baby hasn't vomited since. So like that information sometimes is really, really helpful. And infant colic, this is, I think, my last slide.
This is a big one.
Oh, I know.
Big. I feel like we hear this all the time. Like, is your baby colicky? Like sometimes I'm not even sure exactly. Like I'm so.
Right. And there's different variations of it. I mean, like what I was able to find is like the classification is if your baby cries more than 3 hours a day. And usually this is worse in the first 3 to 4 months, and then it gets better after the 4th month. But what I really say is your baby uncomfortable in their own skin? Does it seem like they have really high levels of tension throughout their body? Are they not able to self-soothe? Can they not stop moving? And they're just kind of like always wiggling. So this is what I consider colic. And this comes back to restoring the cranial rhythm, often, not always, but often. And once you restore the cranial rhythm, their self-soothing mechanism turns on. And then it just allows them to manage life a little bit easier. And usually the other things that go along with it, like inability to pass gas, digestive inflammation, those also pass along with it. One thing, I'm going to get a little bit wooey. I can get a little wooey. But you can't help it with babies, because babies just are little energetic balls, and they perceive emotional pain the same as physical pain. And so if you're having a bad day, the baby's going to know it. And I mean, I have to even consider this whenever I'm treating babies. Like if my heart hurts or I'm having a bad day, like I have to really, really ground myself, or else I'm going to have a really bad visit. The baby's not going to stop crying. They're going to be like, who's this person who needs to figure their stuff out before touching me? Seriously, they know. They look at me. They're like, you can't fool me. And I'm like, I know. I'm sorry. I'm trying.
Babies are so smart. They're smarter than we give them credit for. Absolutely.
They're so aware energetically of what's going on. And so understanding that, I think is really important. And sometimes what will happen is a baby will be colicky, and then I'll work on them, and they'll have this big emotional release where they just start scream crying. And the mom's like, whoa, I've never heard them scream crying like that before. And I say, so this is an emotional release. This is beyond what we really can understand, truthfully. But she's releasing a deep emotional pain. And whether you want to say that comes from in the womb, maybe she picked up on something, generational trauma. They know now that generational trauma really impacts epigenetics and DNA. And who knows what, it really can impact. Who knows where this is coming from, but this is a deep emotional pain. and this baby's letting it out, and they scream and then they let it out, and then after that they calm down. And truthfully, whenever we have those releases, that's whenever I see the most transformation in babies.
That happens in adults too, with craniosacral, fascial work, scar tissue release, like all the time. It just elicits this emotional, whether you're crying or screaming or saying things that you never thought would leave your mouth.
Right.
There's a lot to be said for the body holding on to pain and holding on to tension and having it manifest into physical pain.
Right.
Or GI distress or whatever, what have you.
Because truthfully, I say babies feel emotional pain as physical pain. So do adults. We're just much better at ignoring it.
Mm-hmm.
Last thing worth noting, if you really can't get to the bottom of things, really consider changing your vitamins that you might be on. Just as simple as having the wrong type of iron can sometimes really mess up your baby's gut. So iron bisglycinate, which is what I have here, is the softest and easiest absorbable kind of iron. And that can make a big difference. And I think that's all I have then.
Yeah. And we were talking about, and I just want to draw attention to, you were telling me how one of the telltale signs if your baby is maybe not getting to that last fat source of the breast, or is not latching, it's almost like they tense up and they're gripping their fists, because we know when we're not using muscles effectively that we use global big muscles to help us. So if they look tense, if they look like the shoulders are up, if they look stiff and the hands are gripping or anything like that, that could be a sign that the latching is a problem, or that they're not getting that last bit of milk, or that they're trying too hard.
Thank you so much for saying that. Yeah, if your baby has to try too hard to feed, that's a problem, and you can address that. And I just realized I talked for an hour. So
this is what happens. Like, this is our phone conversations, and we can just go on. And I think it's important information. And, if people have to leave, they're going to get the recording. It's all good. It's all good.
Yeah, that's what I just wanted to say. If you guys have to jump off, totally fine. We're going to send out recordings of all of this. Sorry that I'm a bit long-winded.
Never. Okay. Two things I wanted to touch on is clogged milk ducts and mastitis. People don't know this. Pelvic PT can treat clogged milk ducts. The reason why it happens isn't super well understood, but we can kind of deduce that it's from the breast engorgement with your breast size and your bra change fluctuating. Is your bra fitting correctly? In this country, I think mamas are going back to work so soon. Are you missing feedings? Are you getting the breaks that you need to pump? What I can understand is it's when the milk is sitting there. It's called milk stasis, and it's sitting in the breast, and it's just clogging the whole system. So it can make breastfeeding painful. Physical therapists, pelvic floor PTs can use a variety of modalities: heat, massage, ultrasound has been shown in research to help treat clogged ducts, to pretty much help clear the pipes, right? And get that milk through. We got to push the milk through. Because what can happen is if we have those clogged ducts, it can lead to mastitis, which is the inflammation of the breast tissue itself. And you're going to get these fevery symptoms. It's going to be red. It's going to be hot. It's going to be painful, much like the clogged ducts. You might run a fever, and it can come with or without infection. That's something that's always on my radar with my breastfeeding mamas. To look out for that and to know if and when to refer to the doctor if there is a true infection, to make sure that they're getting the medication, the antibiotics, the care that they need. But they have shown in 2013, the World Health Organization, that the mastitis develops from inefficient breast milk removal. So is it the baby, how they're latching? Is it timing? Is it posture? I mean, we could go down the rabbit hole with this, but just something to be aware of and know that it is treatable.
Yeah, and can I say one more thing about that? So we actually have herbs that we put on the breast, and it's just as, so the breast will actually retract because it's like basically taking a sample of the baby's saliva. So it retracts some of the fluid back up into it so that it can like test what needs to be given. It's so amazing. So whenever you do like that retroactive, I don't even know what it's called necessarily, but and you put the herbs topically, it can be really helpful in treating mastitis. Obviously, if it's to a certain point, then you need to use antibiotics, but there's a lot you can do to avoid it if it's just minor.
Mm-hmm. As far as my recommendations for my mamas from a orthopedic PT mindset. We talk about posture with breastfeeding. We talk about making it easier for yourself. There are so many great products on the market, the Boppy, the My Breast Friend, and we always recommend bringing baby to you. So if you can imagine, and I get it, your baby's the love of your life. It's the cutest thing you've ever seen. All you want to do is snuggle and hold and look like this. If your breastfeeds are anywhere from 10 minutes to 40 minutes and you're in this flex position and your shoulders are up top and you're looking down, this trap is so smushed, your biceps are going to get sore. So we say bring baby up to you, get in a comfortable position that doesn't feel like so much work. We also want to pay attention to, if we get in this rounded position holding baby, we want to make sure that your pec muscles, right in front of your chest, stay nice and open. So I have this like beautiful doorway stretch just to give it a little bit of release, right? And then an upper trap stretch in the bottom right, just to kind of like release that neck. And then I love the side lying position. Head is supported. It's a good position for baby to latch. It's less effort. Maybe you can grab a little cat nap while you're there. But that side lying position is always an option too. I saw this the other day and I got chills. Hold the mother, not the baby, unless otherwise asked. Baby gets a lot of attention, medical attention, follow-ups, visits, vaccines, and mom gets a 6-week, hello, how you doing? Your stitches are healed, off to your own devices. So I just had to share this because I think we do need to ask mom how she's doing mentally, physically, what she needs. I think moms are like the most amazing people. I just don't know how they do it, and they're notorious multitaskers and just have so much on their plates, and it's incredible. Not to mention the physical, developing this child.
Not to mention that the physical, I just had a baby and now I need to carry a carrier, all the baby bag stuff, like probably a purse, like yeah. They come in carrying like 20 different things.
That's why I think, when you tell a pregnant or a new mom, you're like, oh, rest up, make sure you're getting enough to eat and you're sleeping and don't lift too much. Are you kidding me? This woman is going, with or without her partner or her family support to these doctor's visits, schlepping a diaper bag, schlepping, the car seat. I'm like, she's gonna be doing these exercises. She functionally in her life, she has to be lifting. Let's teach her how to do it efficiently. Let's teach her how to protect her body and to decrease the risk of any injury, whether it's pelvic floor, core. So now we're gonna get into pelvic PT. This is my baby. I love treating this population. There's so much that we can do, and I think it doesn't get treated enough. So what is the pelvic floor? What is pelvic floor PT? The pelvic floor muscles is a network of muscles that sits like a bowl at the bottom of your pelvis. To the right up top, it's like a bird's eye view coming down. And then the one underneath, it's almost like you're looking up and in at the tush. And it has a lot of work to do. It plays a lot of roles and it often goes ignored. It's a deep core muscle. It works with your deep core muscles to stabilize that spine in your pelvis. It supports your organs, so your bladder, your uterus, your rectum. It supports baby as you're growing. It has a lot of work to protect your abdominal cavity as baby is growing and protect those organs. Gives us sphincter control so that we're not losing urine or stool. Like I said, at any age, at any stage in your life, losing urine or stool is just, it's so common, especially in this population, but it's not normal. You don't have to accept it as a new norm, or this is my new body, this is my new me. We don't have to be losing urine ever. It has sexual function, so it gives us that sexual pleasure, especially those like layer 3 deep pelvic floor muscles. And it acts as, this is Erin's favorite, as a sump pump. So we think of this gorgeous network of vasculature and nerves and arteries that run through in front of the hip and your lymphatic system, which pretty much like flushes toxins from your body from far away into your fingers and toes, and then flushes it kind of into your core. So if we don't have proper mobility and function of your bony pelvis, of your hips, of your muscles, of those pelvic floor muscles, it can just kind of mess with those mechanisms. We want to make sure that there's, a good balance of mobility and stability of those muscles, of the bony structures. And I like to give everyone a heads up about pelvic floor PT. So, I mean, these are muscles. So pelvic floor physical therapy, we use manual techniques, we use therapeutic exercise, we use different modalities to treat injury. So Erin, you come into me with a rotator cuff injury, you better believe I'm gonna be poking around your shoulder, finding the culprit of your pain. Is something torn? Is there tenderness? One of my mentors in pelvic floor world says normal tissue does not hurt anywhere in the body. The pelvic floor is no different. This is a group of muscles. So more often than not, I mean, the gold standard for assessing the strength, the tone, the tenderness, the trigger points in this group of muscles entails internal examination, either vaginally or rectally. This is one time where being a woman is so much better than being a dude. They only have one option. I'll leave you with that. But that's the gold standard. We joke that pelvic floor PT is like a cat in a bag because we're treating muscles that we can't see. But any trigger points or any tenderness in these muscles, I mean, we're looking at coordination with your breath. We can grade the strength of these muscles and we can kind of pinpoint with bony landmarks internally what we're on and what we're working on and who's the culprit, just like that rotator cuff injury. Just like anything else, just like any other physical therapist, you do as much or as little as you're comfortable with. It is super intimate work. Like you guys are going to become buds, but that's really what you can expect. If you're going to a pelvic floor PT who's setting you up on biofeedback or leaving you to your own devices with certain exercises or isn't really assessing these muscles, give me a call, let's have a chat. I just have different expectations for a good pelvic floor physical therapy examination. So like we talked about, the pelvic floor is a deep core muscle. It's got its three buddies, your diaphragm up top, which is your breathing muscle, which as you inhale should descend and give those organs a little bit of a massage, give a little downward pressure to that pelvic floor and give the pelvic floor a little downward stretch. It's that normal stretch that it needs throughout the day. It can't stay still. It's like a little trampoline down here. When you're running, when you're jumping, it has to have strength and mobility in both directions to suck up and to support and to bulge down, almost like to empty bowels, bladder, to have your baby. We have our tiny little supporting, stabilizing muscles in the back. And then a big topic for diastasis, which we'll get into, is your transversus abdominis, which is your deepest wrap around corset core muscle. So think like Rose from Titanic, and this plays a huge role in postpartum recovery and rehabilitation. So we talked about in the pregnancy webinar about how baby is growing and is taking up space in the abdominal cavity and how those organs just don't have as much room to move. This can lead to constipation, slower motility. The diaphragm doesn't have as much room to descend. So you start, you know, it's very common. My pregnant moms they get a pass. They start breathing with their accessory muscles from their upper trap to lift the rib cage and physically get air in, just because that diaphragm can't work as effectively as it needs to. We talk about how we get into this lordotic, kind of like sticking your tushy out posture during pregnancy because your center of gravity is going forward. Baby is winning, for lack of a better word. So what happens is the back, the superficial tissue, the fascia, the muscles of the back kind of like scrunch up, and then the front ones are getting stretched out. And we know that muscles that are shortened or lengthened just don't fire as effectively as when they're in a nice, happy, neutral state. So that's something we have to take into consideration. And then within a matter of you delivering your baby, your center of gravity has shifted yet again, and your organs have space again. And it's this transition and acclimation to that whole process and kind of getting used to using the correct muscles and what compensations breath-wise and muscle-wise and motor control-wise have we developed in the last 9 months, and how is it going to affect us going forward. So these are some of the big guys that we're going to go through as far as postpartum rehab and diagnosis: back pain, pelvic girdle pain, pubic symphysis dysfunction, painful sex, incontinence, diastasis, which is like my favorite, prolapse. We touched on mastitis, clogged ducts, and then kind of wrapping into how postpartum depression kind of weaves and relates to a lot of this, honestly. And we already discussed the correlation between postpartum depression and urinary incontinence. We know they're so linked, and if we can treat one, it can really affect for the better the quality of life for these mamas. So you're a new mom. Like I was talking about, you're going to your doctor's appointments with your baby, you're schlepping all of this stuff, you have your carrier, you're very active. It's a lot of work. It's a lot of up and down. One thing I really like to talk about is how many times are you bending up and over into your crib, nap time, bedtime, coming back in and out. If we're not lifting correctly, if we're not using our breath to lift, if we are putting too much strain on our vertebra and the disc in between our spine, it can be painful. So I have two recommendations. I say just get like a little step stool so that you have a little bit more advantage, so you're not so curved, and you can really stick that tushy out. When in doubt, stick it out. Keep that back nice and neutral. Reach down to get baby. Exhale on the effort as you lift. Really with anything. So get a step stool in front of the crib. It'll make a big difference. Untuck your butt. So I was talking about that lordotic posture, like the tushy out posture, because belly is big, center of gravity is moving forward, belly is winning. That can carry over into the postpartum period, even when our center of gravity has shifted back to where it started. So you can see that bottom picture. She's kind of just hanging on her joints in her back and her SI joint. And then we also hang on the Y ligaments in the front of the hip. So she's not really activating her glutes. She's not really activating her deep core muscle, her deep transversus to support her. So like I said, moms are notorious multitaskers, and maybe you got a baby in one arm and you're doing computer work or at the stove or doing whatever you need to do, running your errands. So I just try and make a note of being conscious of, do you favor a hip? Do you feel like you're always cocked out to the one side, and how biasing the one side can affect those muscles in your spine and maybe cause some dysfunction or pain within this pelvic girdle, or pelvic ring, I should say. And maybe try to hold baby a little bit more centrally whenever you have a chance. Engage that core and really support yourself to support baby. We talk about during pregnancy how the hormone relaxin is circulating in the body. And it does what it sounds like it does. It relaxes the smooth tissue, the ligaments. So this pelvic girdle, this pelvic ring is expanding, and it has to. It's normal. We're supposed to have instability during this time because we're making room for baby and we're preparing for childbirth. So two of the big sources of pain is this pubic symphysis, the joint in the front, and that SPD, pubic symphysis pubis dysfunction, is what's referred to as that like lightning crotch. Like you take a step or you pivot. Any transitional movements, stairs, going around a curb, can signal this really sharp pain in the front, or vice versa. The same thing can happen with that SIJ, with that sacroiliac joint, and where it's connecting to the pelvic bones. So something I recommended during the pregnancy webinar for pregnancy pains and for the postpartum period, especially if you're still breastfeeding and we're still lax, is the Sorolla belt. And it's an external device that just kind of hugs that pelvis in and force closes those structures, pretty much doing what the ligaments should do. But right now, you know, we have those hormones circulating, and it's normal that they're going to be a little bit more lax. And then pelvic girdle pain is prevalent in like 50% of moms, research has shown. So if you're noticing it or experiencing it, you're in good company, and it is very treatable. It's a term really just for any general pain of the low back, the SI, maybe symphysis pubis, or anywhere in this ring, any sort of dysfunction or disconnect that's going on after birth. This is my favorite. So diastasis recti, or DRA, is the separation of your six-pack muscle. So here are my rectus bellies, and in between them is your linea alba. Your linea alba is a fascial structure connecting these muscle bellies. And more recent research has shown at 35 weeks, all moms have some degree of separation. It makes complete sense. Older research has shown it's more like 66. The problem is when it doesn't resolve. So I like to say, like, I'm happy with a 2-finger separation. The more children you have, the more prone you are for a wider gap. What research has shown is if you have a significant separation at 2 months, it's most likely going to be there at 1 year. I have moms who come in who are learning about this and are noticing it, and they're like, yeah, well, I had my baby like 3 years ago or 5 years ago. I don't think I can make a difference. Not true. There's plenty of techniques and retraining of those muscles that we can do. And it's not always the separation out of these muscles, of your six-pack muscles, but it's how far deep you can get as you're palpating those rectus bellies, because that tells me a lot about the function of the transversus abdominis, that deep core corset wrapping around muscle, okay? If that guy's getting lazy, I can really dig in there and get too deep, and that's really what we want: tension between and we want tension underneath. So we're looking at both. I think that's all I had to say about that. Oh, this is a huge player in hernias and low back pain. We know that the belly button is the path of least resistance, so you're most likely to have separation at the level of the belly button, but this muscle is going all the way from your xiphoid process in your sternum down to your pubic bone. So I check the whole thing just to make sure where the breaks in the fence are, right? Where the weak points are and where we really have to focus. This plays a huge role in transferring your load from one side to the other. So if we have that core weakness, we might notice walking and running being painful. So this is a huge player. And what does it look like? If you are getting out of bed and hoisting up, or you're going back to crunches or sitting, you might notice like a football dome coming in instead of pressing down. So that's a pretty telltale sign of that diastasis recti. And the goal isn't always to get back to 2 fingers. I had a mama come in, she had 1, but she was this petite little thing, and she had different medical conditions that made her more prone for this laxity. And she came in with like a 7-finger separation, no joke. And I got her down to 3 or 4, but she was pain-free. Sex was pain-free. Her back didn't hurt. She was lifting appropriately. So for her, that was her functional, and that's what she was happy with. She was happy with it more aesthetically. She didn't feel like she was football doming or popping out. And she was pain-free. So it's very individual. Go ahead.
I was gonna say, is there something that they can do at home?
Yes. So a lot of what I do, we talked about how the tissues of the low back cinch and how the tissues in the front stretch. So to rebalance what had happened during, your pregnancy, I often start at the low back and I skin roll. It's almost like, and your partner can do this, your husband, you might slap him because it's painful. But grabbing that skin of the low back and just trying to roll it up and release it. And then honestly, I'll get my mamas into like all fours and coax that tissue forward. Because if we still have tissue restriction, we can strengthen the transversus till we're blue in the face. But if the tissue doesn't have that motion, and we're trying to close the gap and it's just, we don't have anywhere to go, it's just not realistic. So a lot of soft tissue work, rolling that low back, bringing the tissue forward into the belly so it has somewhere to go, and then training that deep transversus with the pelvic floor is really how we do it. So sometimes my friends and my mamas are like, I don't want to poke into my own belly. I don't feel comfortable. But if you do, this is just a little example of a self-check. This is the beautiful Sarah Haley. She has a 4th trimester workout program that you can research, but you're really just lying on your back with your feet up, and starting with 2 fingers, you're just above the belly button because the belly button can be a little harsh, and you're really just feeling for either side of those rectus bellies. As you lift your head and your abdomen is contracting, either you're gonna feel a hug between those muscles, or you might feel that separation and, okay, maybe I can get another one in there. And then you're also feeling for how deep in you can get. So if I can get 2 fingers, 3 fingers, and less like a knuckle max, I'm happy. But really, like I said, it all boils down to symptomatic. How are you feeling? How are you functioning? I get this question a lot. Mamas who had C-sections who are like, I don't think I need pelvic floor PT. I didn't deliver vaginally. And it's just not the case. We know from research that C-section mamas have a higher risk of diastasis, and it makes complete sense. Those muscles were cut into. We know any surgery, this is major abdominal surgery, and it needs to be treated as such. I don't, they look like cute little incisions, and, they're very doctors. Some of these doctors are amazing. They're very discreet. But this is major abdominal surgery. And we know that if we cut into muscles anywhere in the body, a patient of mine has a total knee replacement and they go through the quadriceps. We know that these muscles innately guard up to protect ourselves. And also they're like, well, something happened here. We're not sure what, so we're just going to tense. So it's hard to fire those deep core muscles and the rectus bellies because there's been trauma there. We know that the body hugs the scars. Anywhere in the body, tissue can just adhere. So some of my C-section mamas might have more urinary urge or frequency just because that tissue is pulling forward above the pubic bone, very close to the bladder. And maybe the bladder doesn't have as much mobility, doesn't have as much room to move and to wiggle. And it's getting these sensations or inputs that you have to go to the bathroom before you really do. So that's something to think about. Also, if we think about my first time mamas, there are cases definitely where first delivery is a planned C-section, but there are times, I think more frequently, where first moms are pushing and laboring, and then the C-section becomes more of an emergent situation. So we can have trauma in this scar. We can avoid it. It could be hypersensitive, meaning that things that shouldn't hurt are bothersome, like wearing clothes, having your shirt brush up against it. So we often recommend desensitizing it with different materials. Rub it with a cotton swab, rub it with a towel, anything just to bring attention to it and awareness. So it's not just for my vaginal birth mamas. Prolapse is the descent of any pelvic organs. Sounds terrifying, doesn't have to be. It's very treatable. Your pelvic
Sounds terrifying, and I was shocked when I entered basically a medical profession and started talking to women.
Yeah.
How common it is,
Yeah, it's very up to 50% of the population has some degree of prolapse and they're asymptomatic. It's when it's symptomatic, and especially if you've had a vaginal birth and you have true pelvic floor muscle lengthening and weakness and descent, that we have a problem. It can lead to a feeling of heaviness or literally like you're falling out. When you're going to the bathroom, bladder or bowel, it could feel like something's in the way. And innately, often my moms will splint before even being told to do so, which means that you're pushing on the perineum, which is the space between the vagina and the rectum, and you're pushing in this perineum to get something out of the way to then empty your bowel or bladder. So your pelvic organs include, in this order, so here's your sacrum and your spine, and here's your pubic bone, right in that joint. So it's your bladder, your uterus, and your rectum sitting right in front of the sacrum. And it can be treated conservatively. Research has shown stage 1 through 3 had great outcomes as far as urinary incontinence, frequency, and pain and discomfort down there. So just to go through the stages of prolapse, this is we test it by having you do a Valsalva. Like, we need some downward pressure to see what's going on. Sometimes I have to do it in standing. There's times when you don't have a prolapse lying down, even with a Valsalva or downward force, but then you get standing up and you're against gravity and your pelvic floor can't combat that. And that's where the prolapse is very significant. Second degree means that the organ is coming to the level of the vagina, right? It's just popping its head to say hello. Third degree, it's maybe coming out an inch from the vagina, and then proxydenta it's completely out. That typically requires surgery, but we're talking to a population who might still want more children, where surgery is not always an option. And like we said, if it's very treatable from prolapse stage 1 to 3, this is something that we can treat conservatively, that you might even be better off, because we talk about how surgery is always going to be trauma to the body, and it's always going to limit some mobility and some motion, sometimes warranted, but a lot of times there's other options, which is why I wanted to touch upon pessaries. So pessaries are little discs that can help mitigate the symptoms of prolapse. They have this connotation of being for menopausal and postmenopausal women who are experiencing prolapse. But I just want to put the PSA out there of no shame in your game. I have a colleague who became a pelvic floor PT, because after her first birth, she had significant, I think she had like grade 3 prolapse, she had diastasis, she was feeling awful. And I mean, this girl, picture of health, CrossFitter, thin, fit, physical therapist, like, and she went and got a pessary for her workouts and hikes and walking. And that's how she mitigates those symptoms and treats this conservatively. And this is something a pelvic floor PT, at least in the state of New Jersey, can't do. So this is a conversation to have, I believe, either with like OB-GYN or urology, but it's an option. Incontinence is the big one. Can develop during pregnancy, definitely prevalent postpartum, and it can be either stress, which means coughing, sneezing, laughing, jumping, running, or urge, which just means that you can't hold it. You can't make it to the bathroom. You don't have the endurance or the strength and you're losing that urine. They are treated completely differently. They have 2 different mechanisms. So Kegels are not always the answer. I just have to put that PSA out there. And you can have both. You can have mixed symptoms of both sneezing and coughing, and also I just can't make it to the restroom. It is so common. It is so common. It's not normal at any age or any stage. This is something that's very treatable. It's something that a pelvic PT specializes in, and something that should be addressed. You don't need to go buying pads and panty liners. I think it's something that a lot of moms accept as their new norms. And it's great. Like I've heard stories of moms, getting back into Zumba classes together and working out, and they're joking that they're dribbling while they're doing it. And that doesn't need to be the case. I love that, if you have that support, that's so fantastic. I think that's a great thing to do, but you shouldn't be losing urine ever. And then obviously I have to hammer this home, so highly correlated to postpartum depression. It is super common as well to have, they say that dyspareunia or painful sex is like the most common short-term symptom after birth. Up to 50% of moms have it still 3 months after. So that 6-week check-in with the doctor just to make sure the stitches has healed is just not enough. I've heard horror stories of moms going back and saying, something just doesn't feel right, sex isn't enjoyable. And some of the recommendations is, go have a glass of wine and relax, it'll be fine. There are musculoskeletal reasons why sex is painful, and it is so treatable. We talk about the difference between, well, they're treated pretty much the same, but you can have perineal tearing, which we said the perineal body is from the vagina to the rectum. So the worst being grade 4 is all the way to the rectum, and this is highly correlated with fecal incontinence and something that can be addressed. The only difference between tearing naturally if you had a vaginal birth and episiotomy is an incision or a cut, usually by a doctor, to guide where the vagina is tearing to avoid that grade 4 to the rectum tear, because we don't love the outcomes for that. It's tough. We also can experience painful sex after birth, especially if you're breastfeeding, because those estrogen levels, we know that estrogen bulks those muscles. We know that estrogen gives us that lubrication. So you might notice that you're drier. Lube is our best friend. I love, go into your kitchen cupboard. You can use anything. You don't have to go buy anything if you don't want to. Olive oil, avocado oil, almond, coconut, whatever you can find. There's no shame in lube. Lube is our friend. And it's very common after birth to have that dryness. And this is a great resource. Reviving Your Sex Life After Childbirth by Kathy Wallace goes through different techniques, such as working into, so say you had a perineal tear or an episiotomy scar that was stitched up, maybe releasing that scar tissue, just like we released that C-section scar, to make it more pliable, to make it more malleable, to let either a penis, tampon, speculum in there, right? So that's a book worth going through. And then like we touched upon, I mean, no 2 moms' deliveries or babes are the same. Even for the same mom, she might have 2 totally different experiences from her first to second to third. So this is something, it's an individualized plan for you. We talked about stress and urge, urinary incontinence are not treated the same. Kegels are not always the answer, especially if you already have tightness or trigger points down there. It's not uncommon that after birth, even a vaginal birth, that because of the added stress and the added weight of baby and placenta and organs and pressure downwards that our pelvic floor is clenching just to like support us, especially if that abdomen isn't helping us out, that after birth we can have those trigger points there that are contributing to all of this. We want to look at your entire picture. What do you have to do? What's your posture look like? What's your diet? What's your stress level? And then I just have to say, like, my moms come in and they're like, oh my gosh, where were you when I had my first kid? And maybe I'm seeing them postpartum after 3, or maybe they have, you know, their kids are grade school age, which is still great. There's always something that we can do. There's always something that we can do. But I say to them, I'm like, I wish I knew you during your first pregnancy, maybe even before. There's so much prevention wise that we can do and bring awareness to. You don't have to wait until something feels off or wrong. Prevention is key. Finding that deep core muscle and holding baby yourself with those muscles during pregnancy, your postpartum rehab is a cinch as far as that is concerned. So just keeping in mind that it's always an option. And that's it. Erin, do you have anything to add?
No, I think that was really great. And I'm impressed that people, I mean, I think everything was really interesting. Like that,
we kept them.
We kept them. Because it was a lot of information in general, but I think it's all really, really good information for people to have.
Yeah. This was. I mean, we joke that this was like our favorite child. Like this is, I think, both of our favorite populations: postpartum, infants, babies. Helping everyone transition into these new roles and these new phases. I don't know.
Right. So if anyone has any questions, you can ask that, or can also message us privately afterwards.
Mm-hmm.
And
we left our information. Oh, I think I closed it out. We have our information, our email, our numbers. Aha. Right here. But we really thank you guys for joining us, and we just really appreciate it. Erin and I just have a lot of really fun, in-depth conversations about women's health, and we really just wanted to share the knowledge, share the awareness, and provide support, especially during these times right now when I've heard too often, like, friends' lactation and newborn care classes being canceled in person and they're not doing an online supplementation. Like, you always have to find someone to reach out to. You always, you know, have no fear in asking for help. I think this is the time to do it, especially.
Yep.
But there are resources out there even now. And we just, you know, if it's not us, if you're not near us, we want to help you find one.
Yep. All right. Well, thanks for coming, guys. And yeah.
Yay. Bye.